going to say because we record it, it's presented. It will be available online for other folks to watch. So it's a good way to get information if people weren't able to come to the meeting.
Perfect. All right. Well, I'll go ahead and go into the housekeeping slide, and then I'll kick it back to Heather for content. But as Heather said, we are recording. So just be thoughtful of that. It may be shared out probably for folks that weren't able to make it. So just when you're asking questions and sharing information, just be cognizant that this will be shared out afterwards. Use the chat. We have several team members here that are able to help monitor the chat. You're also welcome to raise your hand as well if you're more comfortable doing that to ask a question. We welcome questions, like Heather said. You're welcome to wait until the end, or you're welcome to raise your hand in the middle as well, and we can certainly get your question answered. If a bunch of questions come in through chat and also through raised hands, I'll kind of bounce back and forth. I read the questions out loud too, so it's captured in the recording, which is helpful for folks that weren't able to attend live. Meeting materials can be found on the grant website, which I just shared, but again, I'll share again throughout the webinar. You'll be able to find the grant recording. You can share it with folks. A copy of the RFA is there, frequently asked questions that are updated often. All that information can be found on that grant website. It's definitely your hub for updates in regards to the grant. If you're listening by phone, I'm not sure if we have anybody, but just in case, welcome. You are welcome to press *6 to unmute your line, or *9 to raise your hand throughout the presentation. I'm going to turn on closed captioning as soon as I'm done talking, because I can't multitask. But that'll be turned on, that you can use that as well and access that on the black toolbar on the bottom of your screen. And last but not least, team information about our team and the work we're doing through the Direct Care Workforce team here at HCBS and the Direct Care Workforce Collaborative can be found on the website that I'll drop here in just a moment. So with that, Heather, I will turn it over to you.
Thank you. All right. So a little bit about the training grant purpose. We have been fortunate enough to have the opportunity to put out training grants through ARPA, American Rescue Plan Act funds. Because they are ARPA funds, we do have limitations and eligibility requirements that we have to be mindful of. And so one of those is ensuring that the training opportunities are for the direct care workers. That is quite a broad interpretation of what a direct care worker is. We'll certainly vet that in your applications. But what you would want to look at is the direct care workers are the folks who are directly engaging with the members that you serve. So this is that hands-on care. These are the folks that are not doing administrative or supervisory duties for the most part. They're actually working directly with the individuals. The other component of this is to gain higher level skills that promote greater retention within the direct care workforce. Higher level skills, and this is where we really see a lot of struggles with the applications, is it has to be training that you do not already require of your staff and that the regs do not require of your staff. Some common trainings that we see would be safety care, things informing staff how to handle an individual who might be having challenging behaviors. Especially within the IDD workforce, that is already a requirement that you have to do that. So that would not be a class that we could consider. Now, if there is higher level behavior intervention techniques that you'd like for your staff, then we could consider that. You would want to be real clear in your application, even attach your policy or your training inventory that shows what every staff needs to work for you, and then that'll help us delineate what you're asking for and if it meets the criteria. So think higher level skills. The idea here is we want to be able to give staff the ability to learn things that might help them work with additional members, work at a different level, something that helps them leverage their knowledge, skills, and abilities to a higher level. That is really the intention of this grant. The other part of it that's really important, it has to be for the HCBS workforce, and there is a very specific carve out for CNAs and home health aides within long-term home health for HCBS members. But other than that, it has to be folks that are receiving services or working in the HCBS waivers for individuals receiving services in the HCBS waivers. And it cannot supplant things that they're already required to do. And so really try to hammer those. It has to be higher level. It can't be what you're already supposed to do as a provider or what that individual is already supposed to know to provide that level of care. Next slide, please. We kind of talked about this a little bit, but this kind of helps people hone in who direct care workers are. These are just some specific categories that came out of the waivers that might help folks narrow this down a little bit. But we're looking at, personal care, homemaker, life skills, respite care, community connector. If you have questions about who might be considered a direct care employee, maybe because you're doing something a little bit different outside of the hands-on care here, you're welcome to email us. Next slide. What kind of training? And so if anybody wants to ask in chat or come off mute for the maybes, but we try to get some real specific things of what yes would be here. And these were from some previous grants that have been awarded. One agency looked at developing a mentorship program for their new hires. So they train direct care employees that they have on how to be a mentor. And they developed a mentor program, and they provided 90 days of onboarding of mentoring after that person was onboarded. And so what that included was a mentoring wage for the staff who was doing that work, and routine check-ins with both the mentor and the mentee on how that process was going so they could fine-tune it. Crucial conversations was another training. We've had some requests for trauma-informed care, for motivational interviewing. This is not all-inclusive at all, just to kind of give you a little bit of an idea out there. Sometimes it's really for the staff to maybe work through some stuff that they need to work. We think about grief and aging and losing members. Like, these are all important things that folks might need some extra training in how to work through that, handle it. So, when you're looking at the kind of training that might work for your staff, think about a pretty wide gamut of what might work for them. And the no's, these are pretty clear ones. These are typically required trainings that staff would already need to have. And so we could not fund that. We couldn't fund a train the trainer for these because, again, that would be considered supplanting. They are required. If anybody has any maybes, I'd love to attempt to answer them now. If not, no worries. But we did leave that blank because we want people to kind of to get creative. And please know, we know this is a challenging time. We know that there is a workforce crisis, and it's really hard to think about additional trainings when you're really just trying to get people in the door and ready to do the work that is needed. And so we do understand it's a challenge, and we'd like to be able to help people work through that. Next slide. Eligible applicants, we will do some verification. You do need to be an enrolled HCBS provider. And then there was the other carve out that I talked out. If you're a long-term home health provider and you have CNAs or home health aides, the training could be for them, but again, it would need to be called out in your application that it is specifically for the home health aides and the CNAs. So if you have a home health company and you have RNs and LPNs and some administrative staff, you need to be very clear in your application that the training is for the CNAs and the home health aides. We do allow training vendors to apply for this grant, the caveat being that they would be delivering that training to the HCBS workforce. Now, we've had some vendors who already have an established relationship with a HCBS provider or two, and they're delivering directly to them. We have other vendors who are creating the training or implementing their training statewide, and it's a process of whatever HCBS provider or staff want to sign up for that. So if you have relations with training vendors that you might want to make work with this, please, consider talking with them and seeing who's the best person to apply for the grant. Next slide. Eligible expenses. There is on the website an FAQ, and it lists some specifics in there. It's easier to look at the broad categories. The cost of the training. What does it cost to have that trainer come and do the training? What does it cost to develop that training? When it's training materials, it would be materials directly needed for that training. Are they going to require a handout? Do you have to purchase manuals? Some folks have just been buying ink and paper and kind of printing their own manuals out. You will see on the budget worksheet when you're filling this out, it lists where you can explain what those costs are, and you can attach vendor codes. You can If you've already done the work, just attach those and, you know, reference that in there. If not, be real clear on the spreadsheet that you fill out is how you figured out what things cost. The other thing that can be included in here is staff wages to take the training. So if you are having a training, let's say on Saturday, we're having 20 people come in on Saturday to take this training, then you would want to include that wage that you're going to pay those employees to come in and take that training. The other thing we have seen is folks are having a little bit of a barrier in getting folks to training because there are, you know, everyone has that work-life balance and they haven't budgeted in childcare for this extra training or, you know, any sort of care they're providing. So we've asked folks to maybe consider a training wage that might be a little higher than what you currently pay your staff to help them, reimburse what they need for that daycare provider, that pet sitter, whatever those expenses are. It does need to be explained and within reason. There is no mileage. That's an important one to learn on here. There is no mileage reimbursement. So if you're negotiating for a trainer to come in, that has to be built into the cost. It can't be an itemized breakout of hotel or lodging or transportation costs. So the other thing that we see quite common on applications that isn't allowed is marketing. We do want you to be able to market, quote unquote, market your training to folks, but that really means just getting the word out. You cannot use the grant funds to produce the flyers, to buy ad time, any of that stuff. So marketing is, we try to be real clear on there. It's really, how are you going to advertise this to the folks you want to take the training? We want to plan for that, but it cannot be a specific cost called out. All right, next slide. The guidelines for this, you can apply for the grant more than once. You just have to have wrapped one up. And we've seen this with folks who have a very short-term grant. They're coming, they have a person, they're going to come in and provide a very specific training on a very specific date or two. They wrap that up. Once that's closed out, they can apply for another grant if they have maybe a secondary training they want to do. Those are an option. You feel free to talk with us if you have an open grant and you're trying to plan some stuff out for maybe a second one. The other big component is nothing can be done until after you have a grant agreement signed and an approved work plan. So when you're thinking of your timelines, starting stuff now is great if you're doing it in thought, but you would not be able to use grant funds to reimburse things that you've spent now today when the awards won't be out until June 15th and the grant agreement out until July 1. So just keep that in mind with your planning. Next slide. Here is the grant cycles. We have 3 more to go. So this grant cycle will close 5 p.m. May 31st. We will announce, everyone will get an email saying yay or nay on June 15th. It is important to know that maybe only part of your grant would be covered or approved. Sometimes people have applied for stuff and 75% of what they've applied for hits the mark, but there's 25% of their cost we could not cover because it's supplanting or doesn't meet the guidelines. Then they would get 75% of that award. So just something to be mindful in there. We are trying to be real clear so folks know what the award was. So we will tell you very specifically if it wasn't as written what you were approved for. The grant and review committee can also ask you questions. So we always ask folks to please pay attention to your emails, especially towards the end of the grant cycle. They'll come back with maybe clarifying questions they need in order to make their decision. So we want to be able to provide that to them so that they can fully evaluate your application. And 3 more cycles to go. So please tell your friends. We would love to get this money out to as many people as possible. Last grant cycle, I think we had over 15 awardees. Which was pretty good. I think we had about 29 applicants. So people are really fine tuning their applications and more are getting approved. All right, next slide. I know Brooke has dropped it in there a few times, but the application is in Smartsheet. It is on the website. You fill it all out. Some things are required, some things aren't. It should be pretty clear on there. It'll have an asterisk if it's required or not. The project budget is a spreadsheet. All you need to do is download it from the website. Some folks ask for it to be shared. We don't share that document because if someone fills it out, then everyone else has your information. So when you get to that link, you just download the budget worksheet. If you're having trouble with that, email us. We'll send you a copy. You will need to attach a W-9. If you're a nonprofit, we do need a certificate of good standing. And we also need a cover letter signed by either the executive director or the authorizing official stating that they are aware of the application and an agreement with it. We know that there are some really like kind-hearted, energetic folks out there who really might want to do this, but they might not have the approval for that. So we want to verify that the folks have approval, or at least they're, whoever's paying this money out to begin with, because it is reimbursement based, knows who's got the, who requested the money and what was approved. So just be mindful of that. All right, next slide. This is the time for you. If anybody has questions, and if you join late and you missed something, feel free to holler. We will backtrack as much as we need to. Just while we're waiting for questions, I will say all the previous recordings are on the website. The FAQ is on the website. We always ask folks to kind of look through that as you're filling out the application, because there might be thoughts or questions you have that are answered from that. If you don't find the answer that you need, feel free to email us at the email there on the slide. We will get back to you as quickly as possible. And my personal thing is don't wait till 4 o'clock on the 31st to apply, but you can if you want to. That's the rules. It gets real challenging at the end of the day to make sure we have them all, but we're really happy to get everyone's in. We'll stay late. It is 5 p.m. on the 31st, though. We do shut the application off after that to make modifications.
I'm not seeing anything coming through the chat. And then just a reminder, you're welcome to use the chat if you have a question, or also raise your hand. We will accept them either way.
And the other, while you're thinking of a really good question, the other thing I would like to remind you all of is that we do have a grant available for direct care workers themselves to apply for. The provider grant is up to $100,000. So anything up to $100,000. You doesn't need to be $100,000. It can be $10,000. We really want it to be what's doable for you. It is reimbursement based, so it works in a 20-60-20 of ways. So you have your plan. Once you get approved, you complete a work plan and you get 20% of your award for that work plan. So that would be maybe your seed money, your start money. And then you have 60% of your total award that you're billing monthly as those expenses happen. And then 20% of your award is reserved until the end. We do have a post-project survey that we require folks to fill out. And then once that is done, then you get the final 20%. The individual grant that I mentioned is up to $500. And this is for direct care staff to do kind of the same thing, any higher level training they want. That is open through December as well. You can find that on the website. We'd love for you to share that with your staff. And those awards are awarded every 15 days, well, usually every month. So they'll have a notice within 15 days and the award will be ready pretty quickly. So if that's something we would love for folks to get the word out as well. All right. Well, if we don't have any more questions, we will end it early. Thank you for your time. We will get this recording up on the website. And again, you're welcome to check the website and see if you have get any of your questions answered there. If not, feel free to email us.
All right. Well, thank you all very much. And I'll go ahead and stop share and go ahead and end the session.
All right. Thank you, everybody.
Have a good day. Thanks.